Okay, first things first. Um, how is it going with studying? I know Jason, you and I talked about this. Charlie and I live with you, so
Mhm.
there's that. Um, what's the pattern? I know everyone is going to be testing pretty quickly.
Yeah. So the pattern,
Mm-hmm.
I mean, with what we talked about today, I mean, just I'm gonna be watching a lot of videos this weekend. The Google Drive, and everything. So well, the kids are away. I don't get to play. I get to study.
Nice.
How lame is that?
It's great.
Yeah, actually it is. So I'll make myself I'll put some candles out and make it romantic with the test material and I'll have a glass of wine or a
Just
bottle or
Mm.
fall
two.
just fall in love with this test material and this sweet, sweet
Right.
LCSW. So Dr. Graham, how can we pass this LCSW? We need this.
Awesome. Okay, so I know Jason, you and I talked today about some.
Oh, I'm sorry. Just that's so cute. So
Awesome.
sorry, squirrel.
Perfect. Squirrel. Yes. So that was one of the things that we talked about was um, the frequent distractions when it comes to setting up a standard for testing and even a simple. You good,
I'm
Charlie?
following you, Christopher.
Okay. So I think Jason's response to poor study habits was maybe it's ADD. And my thought is probably not ADD, but probably like squirrel disorder. So it's super easy to get caught up with 1,000 other things. And I'm guilty, right? The moment I have something important that has to be done, it's the moment that anything else is more important than sitting there and just grinding. Okay. So how do we deal with the squirrel disorder? And what is your
Well,
squirrel?
in the
Let's just
South,
talk
they
about
shoot the squirrel.
what's okay. Yeah, you would, and you'd eat that joker.
Uh-huh.
So, what is your squirrel? The root of your squirrel is what?
It's so for me, I love social work. I love what we do. I love the principles of it and stuff like that. Um, but to stay focused on this is so hard to do sometimes. And it reminds me of, and did I tell you about the clip I saw about how somebody tried to explain what ADHD was? It was like a YouTube clip or something, and it
Mhm.
showed a kid in a chair, in a rocking chair or a spinning chair, and this kid is watching a math tutorial, and this kid is spinning around in a chair, not paying attention, and they're saying, "This is what ADHD is," and I'm like, "Okay, cool." And then the next video is the same kid, same chair, same TV, everything like that, but he's watching like Star Wars or something, and he's focused on Star Wars, and it's like this is the kid when he's not on ADHD or when he doesn't have. And I'm like, that's not ADHD. The kid is interested in what he's watching. This test material is not Star Wars. Like I watched Ahsoka last night with my son, and I
Did it
was
sound?
focused. Oh, it was phenomenal. So
We'll see.
sorry. So, well, I
I
liked
have
it.
no faith in
Um,
Disney Plus anymore. They've ruined so many things. So many
well,
things.
have you seen Star Wars Rebels?
I've seen some of it. I haven't watched the whole thing.
Okay, so you they reference a lot back to Star Wars Rebels, a lot. So if you haven't seen all of Star Wars Rebels, you're not going to understand the characters. And like what I was trying to explain, squirrel mentality. this is squirrel mentality. We're now like, yay, Star Wars.
Right.
We can talk about this forever. And see, that's my problem. I'd much rather talk to you, Christopher, about Star Wars
Sure.
and everything than this test stuff. Even though I do really love it and I love what we do, it's just this test is just so hard and depressing. And I'm trying to stay positive. This is me trying to stay positive. I'm not trying to diss it. I'm not trying to knock it or anything like that. It's just the reality of it. It's just that it's. I've never been a good test taker, and it's just one of those things that I really gotta. I have a lot of demons in my past with taking tests, and after 40 years, 44 years, I've got to beat those demons down now. Where I've always been able to slide by passing, and this test you can't slide by. I have to beat the demons down and be like, I'm gonna pass.
Right.
Sorry.
No, that's good. I think that's great.
I
Charlene,
feel
what
like I'm
about
in a
you?
confessional.
No, it's perfect. It's perfect. Charlene, what are your squirrels?
Mine is very similar to that. And I can tell you even my scroll that happened during the last test. And in the middle of that test, I got to be honest, in the middle of that test, I knew I wasn't going to pass. I knew it. In the middle of that test, I was like, you can't do this. You literally can't do this. This is harder for you. I mean, and I did better than I've done than the last one. But I knew it. Like I knew that day I wasn't going to pass because the questions, I just guess I tripped myself up or whatever I had done, and I knew it. And I guess my squirrel would be like, I got to work on that confidence and then being like, okay, like I didn't have any anxiety or any worry or anything like that going into it. But in the middle of that test, I was like, you can't do this. You will not pass this test. This test at this point in your career is too much for you. And I think maybe that plays into my studying and other stuff. I don't know. I think, yeah, I do. I think that plays into it. Because as much as I think we're really good social workers. We are like
Here we
the
are.
love and compassion and the things that we're able to create and do that we learned as social workers, like constantly out of the box with resourcing and different therapy techniques. You know, I was sitting in a session the other day and it was just kind of like, I think this new parent needs to be able to hug this new adopted child's hand, like hold their hand, hold their hand. And it was like in that moment that came to me and I asked them if they'd like to do that. They did it. And they were both so overcome with emotion, they instantly started crying because they hadn't allowed themselves to experience that safe moment. And I'm like, this is my calling. I love this. The LCSW is whooping me and I don't know how to whoop it back. So
the squirrel is disappointment, disbelief, discouragement. And so if I can't do it, why am I even trying?
yeah,
Like in the middle of a test, which is like the worst time to have that assist.
literally, y'all. But I gave myself a pep talk and I was like, it's okay. It's okay that you can't do it. Just continue on and give it your best. You're gonna fail. I did, y'all. I really had a pep talk with myself and I was like, it's okay. It's okay that you're gonna fail. And it's okay that you can't pass this test. It's okay. Continue working.
The old college try. Okay, so that negativity, that discouragement, that voice, this is not whether or not you guys are good social workers. This test does not measure how great of a social worker you can or can't be. It's simply an evaluation of applied social work knowledge across all social work professions, right? So it has nothing to do with your intellect or your social work skills. It has everything to do with finding the right answers. That's all it is. It is not about It's not really even about social work. It's just the way that we've measured. We've got non-social work people, or we've got really awful social workers that can pass this test with ease and have no desire to be in the field.
Yeah.
Because it's not about clinical social work. It's simply, and this is the only thing that this is, it's finding the rightest answer of 3 or 4 right answers and answering it like most social workers would answer it. This is not about you. Most
Always
social
about me.
workers, it's always about you. It's not about you. And it's not, getting an A on this test is pointless. If you get an A on this test, it means that you can answer standardized questions fantastically. We're not aiming for an A, we're aiming for a pass.
That's all I want. I'll be happy. After all these tests, I'll be happy with just a pass.
So at this stage, then, it comes down to studying how do I answer standardized questions in a field I don't feel comfortable with. You can practice that by answering, and Jason, you and I talked about this earlier. You can practice doing that by taking a standardized test in math or English or some other field, or some kind of nursing test, or you can take any kind of standardized test and practice answering standardized questions, because it is not about your knowledge. It's about, can you select the right answer, even when you don't know the right answer.
Yeah.
Carlene, what are your thoughts?
So,
Go for it, Jason.
well, I'm. This might be off topic a little bit, but with the test that we're taking now, how is this going to be different than on January 2nd, when the testing facility is going to change to this new one? Are the tests going to stay the same, or is it just a different testing facility? That's all it is?
Tests will be the same.
Okay.
Yeah, the ASWB still does the test. So I have not looked into it entirely, so I'm not exactly sure what they're changing, but the test center that they're contracting with is going to be different. So I think that they're going to allow for testing, how to describe it, like in-home testing. I think that's what we're looking at, like options for in-home.
So it's easier to cheat.
Potentially, but not really. I mean, they have a camera on you in your workspace, and you can't like get up. Like it's very locked down. If that is the major change, then that would be the thing. And yet, let me tell you, how much easier is it going to be? How many times have I told you guys to take the practice tests as if you were in the testing center doing the things? So now, if this is the change that they're doing, now how much easier is it going to be for you to actually literally imitate exactly what it would be like on a test day and do a full 4-hour test once a month, right? Like just 170 questions every month, once a month, in the exact space that you would typically do a standardized test. I mean, so if that's the case, I think that creates an advantage, not to make it easier to cheat, but I think to make it more comfortable, as opposed to doing all of that, going to a test center and having to drive to Dallas or, staying the night somewhere or whatever. Get some rest, get up, get comfortable, be in your pajamas, whatever. So, but I don't know for sure if that was the change, but that just makes sense to me. Okay, so squirrels. Dealing with the squirrels. No one likes studying. I say that. Some people love studying, but studying for something that you're not interested in is extremely difficult.
Hard.
It's hard to stay motivated. It's hard to stay energized.
Mm-hmm.
And patterning behavior for exactly what it's going to be like in the test center. And we've talked about this before, but when you go into the test center, you can take cough drops. Take the sweetest cough drops that you can find. If you're going to build a battle station, and that's what I think we need to do, is you guys need to have battle stations that are specifically designed for studying. A space in your home, in your garage, at your office, I don't care, that is specifically designed for studying, that every single day you're going to war against your squirrels and you're going to defeat your squirrels for 30 minutes to 60 minutes. And you're just going to study. You're going to take practice tests. And here's the issue that I see a lot. People make their bedroom their battle station. Your bed is not the place to take practice tests. It's not realistic. It's not practical. You cannot take this test in your bed. Okay?
Yeah.
It makes it, in my mind, it makes it easier to create consistency when you create a clear path to getting something done. So if I know that 3 days a week, I'm studying for 1 hour, 3 days a week, I need to have a space specifically designated where it's like plug and play. You got one outlet, you plug it in, right? It's the same light, it's the same desk. You have some office space or whatever where this is the space. And I would even suggest, like, make it, even if you make it like a space on your dining room table, like off to the side, if that's the case, if that works for you, with noise canceling headphones so the kids can't distract you, the cats can't distract you, right? Whatever you have to do. And then even on that space, so we have like a desk right here, right? Charlene, this is your desk. So if you were coming down here, you could even have like a piece of paper or a calendar that you have right in front of you, that when you finish studying for that day, you check it off. 3 days a week, right? Jason, you and I talked about this earlier. No one accidentally wakes up and has abs unless you're the Tobey Maguire Spider-Man, right? Like, it just doesn't happen. Everything that brings value costs something. I'll say that again. Everything that brings value costs something. You can either work now and play later, or you can play now, but it is going to prolong your suffering and you'll be working harder, longer, later. No pressure. We're on the wire here. So walk me through it. What are your thoughts?
I mean, it's just really getting down to it and just doing it. And just figuring out what's going to be the best options and the best, and to make it, to defeat our squirrels. So, because honestly, Charlene, with what you said, it's like halfway through the test, you know, it's like, I'm not going to pass this test. That's not good thinking, but I can't say anything because I think I've had that feeling too. I mean, have like 25 questions in, I'm doing awesome. Another 25 questions in, oh my God, I suck. It's just, I mean, it's like you go through the 7 stages of grief in 4 hours. So, I don't know. I know it's funny, but I'm not trying to be funny. It's just, I'm just so sad. So, hold on 1 second.
Okay. Arlene, what are your thoughts?
No, I mean that crunch time is real. I mean, I'm like either I'm gonna do this. I have one more year. That's all I have. I have one more year and then I have to go into supervision again. It's not this is it, or it's gonna control the next few years of my life.
Right.
And then I only have 1 year after that. So like I am on is it 2 or just 1? 2 years of supervision, then 1 year to pass.
But it was 2 years to pass.
I don't know if it's that I don't know. So
I thought it was 2 years.
I'm having that thought though. I'm like, this is more years of your life delayed in this limbo.
Right.
This limbo is
Right.
a horrible feeling. It doesn't feel great at all. So I'm just trying to.
I don't want to
If
be
I d-
50 when I pass this test.
I
I want to be.
I dwell on it. I become sad, and then your sadness turns into lack of motivation in this world because you're like, is this even feasible for me? It's
Mm.
the struggle bus is real, man.
This is entirely possible. It's entirely possible. If the old ways of studying for years have not worked, then changing the study patterns, that has to happen. If the old way of retaining information hasn't worked and applying information, then you have to change that path. You have to.
I think
You're-
that one of the things we got to do to change too is, and Christopher, you've said this multiple times, and I'm sorry, but like when we meet on a weekly basis or on nightly basis or whatever, we can't be doing test questions every single time because it's not helping. We've really got to start nailing down the homework assignments and teaching each other, like Chris,
Yes.
like Dr. Graham has been saying, and everything, because I really do think that that's going to help us in the long run. But doing these questions over and over and over is not going to help us pass this test.
Yeah. I think so many people love the idea of doing practice tests in group settings, but that is not studying. That's practice. That's practice. The content, and I've said this so many times, the content you learn while you're taking practice tests is not content that you need to retain.
Yeah.
You need to, in those settings where you're missing questions, you need to know why you're missing and how to find the right answer. Not to go back and, oh, I need to get this in, you know, what you and I talked about, Jason, but like going and learning a bunch of medications because there are 2 questions on the test and you missed one on the practice exam. What a waste of energy. Like that's half a percentage on your test, right? Like all of the things that you could be spending time on. And if you're in a study group, focus on, I love that you said that, focus on the homework assignments. Give each other homework assignments. There are certain theories and approaches, treatment modalities, things that I gravitate to, diagnoses. There are things and ethics and processes that I absolutely love. And it's easy for me to focus on those things. However, when I get into a group, I want to hear, well, how do you apply that? Right? Let's have a discussion about, okay, if I know that if I know that recovery-oriented cognitive therapy is how I treat schizophrenia based on the DSM criteria, differential diagnoses, and all of this stuff, I want to know what you in a different area, working in children's, right, or working at a hospital, how do you approach schizophrenia? How does that diagnosis come up, right? So really, like a homework assignment could be that every week you guys talk about a diagnosis and you talk about a different type of approach to that diagnosis. So let's say 1 week you're going to talk about mood disorders. Okay. And then everyone chooses a diagnosis and a differential diagnosis and you process that. That's good study. You're going to probably retain more going over content together than you would if you just did 10 questions on diagnosing. And then you get, 6 right and 4 wrong, and you're discouraged when you get them wrong. And you're like, oh, I need to memorize this stuff. No, you don't. So I would definitely challenge that you focus on, in your group times, you guys focus on actual assignments and going over content. The 3 things, and I've mentioned this before, the 3 things that if I had a year left, like the 3 things that I would be focusing on would be code of ethics. I would memorize the code of ethics. I would understand to the best of my ability how they apply in different social work settings and how they fit broadly across this social work practice. Okay. And I would talk about that. Like I would have discussions about not just ethical dilemmas, but actual, like, say, a dilemma and how do ethics fit. Okay. So that'd be the first thing that I would study. That I would memorize that as best as I could. The second thing that I would focus on, and you've heard me say this before, diagnoses and differential diagnoses. Understanding, not memorizing the entirety of the DSM. That's not the goal. The goal is, can you lump it into common diagnostic categories? And the big 5 that I would say are probably the most likely to be seen on a test are going to be depression, anxiety disorders, the bipolar disorders, schizophrenic or psychotic disorders, and then childhood disorders or neurological disorders. Those 5 categories are the ones that if I had a short amount of time, I would focus a lot of energy into understanding what makes those disorders meaningful. Okay. And how and why we see them in the field. Right. And those 2 things you can really memorize and apply. Okay. But the third thing that I would really focus on, not for memorization, but completely for application. How does this work in different social work settings? The third thing that I would focus on would be stages and life cycles. I would be looking at human development and behavior, right? Because you're going to get the screening, assessment, and treatment plan development. You're going to get the case management piece by looking at differential diagnoses, right? You're going to get the ethical dilemmas by going over the NASW Code of Ethics. Okay, vignettes and all that stuff, you're going to be able to touch on that. But as far as the life cycles and the stages and all of that, it's not regurgitation, it's application. So I would really practice applying life cycle and stages. And I would do it personally. Here's what I would do. Okay. I would start easy, and I would do low-hanging fruit. Low-hanging fruit. The easiest way to approach it is for life cycles. I would look at early childhood development, and I would do a case study of my kids. I would look at, okay, how does this fit? If I take my kid, you're not doing therapy on your kid, but you know your kid. Okay. I would say, well, maybe, but I would say I would take my kid and I would do a case study, and I would say, okay, how do each of these theorists fit or not fit with my child? And it's hypothetical. So like you can add data, you can take data away, whatever you want. And then I present that as a case study. Okay. I would say where for my peers or like my spouse, because they would typically be in, your age. So they're going to be in 30s, 40s, or wherever you are. So I'm going to look at my spouse or my partner or my close friends. And I'm going to say, how do these life cycles fit with these people? I'm going to do a case study. And then I'm going to say my grandparents or my parents or the elderly people in my life, where do life cycles fit with that? And you can look at all Freudian theories, you can look at Erickson's, you can look at Kohlberg, you can look at every theorist that has some kind of a stages or life cycle. Just apply it to each of those categories, to each of those age groups, and see where it fits. Okay? And think about how that applies across the board. So those are the 3 things that I would focus on, and I would encourage you guys to do. Ethics, differential diagnosis, and application of life cycle and stages. And I would present that content in group. I think you'll understand it more when you do that.
Can you give me an example of differential diagnosis?
Yeah. So I would say, let's go to schizophrenia, right? So if someone is diagnosed with schizophrenia, there are specific symptoms and timeframes that you have to look for. However, if someone is experiencing an acute psychotic episode, that is different. It's maybe the same types of symptoms, but the time frame is going to be different. Or if someone is dealing with mood imbalances and psychotic features, but the psychotic features are the primary issue, well, that's going to be more schizoaffective, right? Or you're going to have like schizotypal, right? Or schizophreniform. So I would look at, okay, this group of psychotic features or diagnoses, what makes them different? And I'd present on that. I'd say, look, this is what I was studying. And I would say, let's make our group, and you can plan these out. You could say, we're meeting every Tuesday afternoon at 8:00. And every Tuesday, these are the categories for the next 4 weeks that we're going to be discussing for differential diagnosis. We're going to talk about childhood disorders this coming Tuesday. The next Tuesday after that is going to be psychotic disorders, schizophrenia. The week after that is going to be personality disorders. The week after that is going to be other mood disorders, right? And you can just literally break it down into categories. And then you can do substance abuse, and then you can incorporate even in the medication issues that come up with that as well. And you can incorporate that into the discussion on these are the diagnostic categories that we're going to discuss every single week. How impactful would that be? And it's not nearly as boring as sitting there and just hashing away at test questions or randomly pulling out, well, what are we going to talk about today? Bro, you know, right? Like we've got it 6 weeks planned out. We know exactly which diagnoses we're going to talk about. We know exactly what stages we're going to talk about.
So I like that. So, like, you know, we always say that we're going to be like me, like every single night, Monday, Tuesday, Wednesday, Thursday. That's too much.
It's a lot. It's too much.
It's like, I mean, I like you all. You know, and I consider you all like almost like family now because we meet so often. You know, we're family. You know, like you know, Fast and Furious, like what Dom says, we're family. You know, but I can't. You know, if I don't pass, I mean, I want to pass this time around. I want to pass. I'm going to pass. But just in case I don't, I can't meet every single night. So what nights will be good to meet? Like 2 times a week, like Monday, Thursday.
It's perfect.
So that way we're not oversaturating it. And then like on Tuesdays, Wednesdays, we can study on our own. We can do the research. And then to prepare for Thursdays, and then to prepare on Mondays, we got the weekend to prepare as well.
Fantastic. As long as you're doing the homework.
Yes.
I got
my son. Yeah, and I got my son now out here on the table. I've set up his study place where he studies, and I think I'm just gonna sit across the table from him, and I'm gonna study with him. I'm just gonna study my stuff. He'll study his, and I'm like, okay, buddy, we're studying now. So
perfect.
Yeah,
that's perfect.
So I think that's what we're gonna do. So Charlene, you cool with that? Monday, Thursday? Okay. So that way we won't get tired. Because I'll be honest with you, sometimes when we meet, it's like, hey, are we meeting tonight? We meeting tonight? It's like, are we already meeting again? It's like we just saw each other like the last 2 nights. So I think that's where I get like kind of discouraged, and then I just need to take a break from you all.
I love that.
You don't really want to see all the time, but you have to. And you're like, oh, man.
Right.
I want to see you from a distance sometimes.
Because I think that's what's going to help us too. It's like, hey, we only see each other 2 days a week, so we really got to
Yeah.
get down and study, and it's like, oh, I'm going to see you tomorrow. Let's talk about it tomorrow. So let's talk about other stuff that's going on that's
Right.
not relevant to the test.
And it's not helpful.
Yeah.
It's not helpful. I love that idea.
So
I love that idea. I think
okay.
you guys are right on track.
I thought it was going to hurt y'all's feelings, like not wanting to see you every night.
Hey, man, no
It's
one has time for
mutual.
that.
It's
Yeah.
mutual.
No one has time for that every night. Like I would say you need to study, right? And
Yes.
do your homework. Okay. You have work and you also have homework. All right. And if you can incorporate both of those in and you can study while you're at work, by that I mean you're diagnosing people all the time. So to study differential diagnosis is really just going to work. You know what I mean?
Yeah.
Have a conversation. And oh my goodness, for you guys specifically working in community mental health centers, like your access to resources is just tremendous. So you can study, again, we'll go to psychotic disorders, and you can say, these are the ways that we see psychotic disorders in our adults and our children, how adults with psychotic disorders affect our children. But then you can also go over to the nurse practitioner and you can say, hey, I've got this person that's diagnosed with schizoaffective disorder. And I see that they're on these medications. Can you tell me why? I can't imagine our doctors or nurse practitioners wouldn't want to share that. Or like Charlene, you have Kelly. Like Kelly's a pharmacist. Kelly will give you. I mean, she's given you books on medications, right?
No, I actually went to my desk yesterday, last week, and my nurse had made me a like top medication list of their names and what they were for. And I was like, okay, but now we got to like talk about these. So when people get on stuff, like we just make sure we're hitting all these or give me like scenarios.
Perfect.
Yeah.
So then the only thing that I think about, I worry about, my biggest concern is, and this is not something I need you to answer now, but I need you to be aware of it because this is my fear. I fear that you don't have the courage to kill the squirrel. I think the squirrel sometimes becomes too intimidating, or it's too embarrassing to say, I love you, but we're not on track right now, and we need to be on track. I have told Gracie that she needs to be a butthead. I've encouraged her to like, Gracie, just tell them that it's time to study. Put your mom voice on and just be like, no, get your hand up. Like, no, right? And so I would encourage you guys, like, find the courage to kill the squirrel every single day. And it's not like you can't revive it later. Yo, study at my favorite. Here, this got me through postgraduate school. Pomodoro technique is my absolute favorite approach to study. I use it all the time. You can find it on YouTube. There are so many different videos on this. Study With Me is a great YouTube channel, and it just uses the Pomodoro technique. All that is, and it runs a timer on YouTube for you, lo-fi music, whatever, 25 minutes of work, nonstop work. While the music's playing, you're working, okay? And then 5 minutes of break. When the music stops, bell goes off, you go on break. You don't touch anything, you don't do anything, just 25 minutes. You can do anything for 25 minutes. But having that auditory cue to say, we're in study mode, don't distract me. And Charlene, you know, I used to have, like, I have lights up here and in the hallway coming downstairs to the den, because if it was red in the hallway, that means like, don't bother me. Please don't knock on the door. Don't come down. I don't want to hear you. Like, don't come down. But if it was blue, then you could come down. You just had to be quiet. And if it was green, you could come down, be quiet. And if you needed to, you can knock on the door. Right. And if it was off, just it's free roam. So I think Have a technique that makes you look like a butthead, but gets you the results that you want. The test doesn't care about you. It doesn't care about your experience, your knowledge, your abilities. It only cares about validating the social work field. Okay? So kill the squirrels, focus for 25 or 30 minutes every day, and do your study groups, but do homework. Do practice. Practice tests are on your own. Don't do them in a group. That's not study time. That's practice time. Okay? Do a practice test on your own. I would say even every Saturday morning, start your day in your private space with a 30-question test. Pocket Prep is great. I love them. They're great. Or find one online. 30-question test every Saturday. 25 questions, whatever. But none of these 5 questions, 10 questions, just do it. Y'all okay with this?
I do have one question. Okay. I know, just because I know me. If I don't have a specific plan, I'll be all over the place. I'm the worst with the rabbit hole and all over, and I'll be flipping here, flipping there, da da da. And I got my stuff written down about what to do. So I'm thinking about the time frame. So doing the time frame, should I do the hour and maybe break it into like, I don't know.
Here's what I would suggest. If you want to do an hour and you know that you're going to be squirrely,
or maybe I want to do 100 minutes and just break it into 25, like $1.
No, you could. Well, I would say this would be my challenge to you. If you know you're going to be squirrely and you know you cannot focus for that long, then set up 1 hour and do 10-minute Pomodoros. So you do 10 minutes and then 5 minutes off. 10 minutes on, 5 minutes off, and you do it 4 times. 4 Pomodoros of 10 and 5. Done. You'll be done before you realize. And you'll find that you're energized the entire time. 10 and 5. And that 10 minutes goes by so fast. But if you force yourself to take a break, you don't feel like you're missing or losing anything. So 1 hour, 4 15-minute Pomodoros. So you're doing 10 and 5, and you're done. Or if you can only do, that 2 days a week and then you're doing your group, and I would even encourage you to do the Pomodoros during your group, right? 25 and 5 twice for a full 1 hour group, right? That's fabulous. But I would say if you can't do, because that ends up being a lot of study time. It's a lot of time and not much time to just chill. So if you're doing 2 study groups on, you said Monday and Thursday, so that's 2 hours, 1 hour each day, 2 Pomodoros of 25 and 5. On your off days, maybe on Saturday, do an hour, 4 Pomodoros, right? 10 and 5, 10 and 5, 10 and 5, 10 and 5. Friday night, chill on Friday. If you want to do one, maybe do 30 minutes, 2 Pomodoros, 10 and 5, 10 and 5, and be done, right? Something like that. And then on Wednesday, the same thing. You could do 30 minutes or an hour, whatever. But what you're going to find if you do that, if you come up with a plan that works for you, you're going to find that you get more accomplished in the 10 minutes than you would in 30 minutes of sporadic studying and distraction. Go hard for 30 minutes or an hour. Schedule this out. Plan your content. Put it on a calendar. Put it on a checklist. Send a lesson plan to each other and hold each other accountable. You guys are going to pass this, but I'm telling you, because I love you both, this will not happen by accident. You have to be intentional. Even putting on your TV something that says, did you study for an hour? Don't remove this until you've studied for an hour, right? Let your kids hold you accountable. Have them do a token economy for yourself. How about this? Do a token economy for yourself to where you give your kids Monopoly money. And you say, Daddy needs, Mommy needs Monopoly money so that I can play video games or I can watch TV or I can get on Facebook and do whatever I want. And the only way that you can pay me my Monopoly money, this is not Monopoly money, it's a business card, but the only way you can pay me Monopoly money is if I come to you and I tell you that I did my Pomodoro. And every Pomodoro I do, you're going to give me money. You're going to give me a ticket. And then I get to cash those tickets in at the end of the day for video game time, hangout time, TV time, whatever. Right? Or I get to hold my tickets or whatever. But bring your family in to hold you accountable. You'll have the time of your life. You'll have the time of your life. The kids will love it. Your family will love it. Your spouse will love holding you accountable. Charlene, as your spouse, I can tell you I would love holding you accountable. So, come up with a plan, but ultimately you just got to do it, y'all. Kill the squirrel, cook that joker, and move on with your life.
Yeah. I like this new plan that we've got.
Okay. It's 9:05. I'm going to jump off. But if you guys want to hang out, you're welcome to. But I think you guys have a good plan. I might encourage you to say, before you guys get off today, I might say just hash out a specific plan for the next 2 weeks, right? Jason, you're going to test really soon. So if not, I think you should still test on Monday, or I'm sorry, you should still study or just meet on Monday for consistency's sake. But that's just, Charlie, y'all don't have to.
I'll be in Tulsa. I'll be in Tulsa on Monday night, and I was going to have some tacos with a buddy of mine in Tulsa.
Oh, dude, do that. Do that.
Do you all know of a good Mexican joint in Tulsa?
Yes. No, what is it? It's
that's super authentic, Jason. How Mexican do you want to get?
Very Mexican.
Verde? Is it Cafe Verde?
We have this. It's authentic. Like it's a block building. Okay.
Man, it's so good though.
It's super authentic. It is small.
Okay.
You can look it up. So,
I'm looking at.
So Jason, this is just my thought. Let's email
El Rio
plan.
Verde. El Rio Verde.
El Rio Verde.
El Rio Verde.
Okay.
Tulsa. That's the spot to go. Yep. It's awesome. Okay. It's super good. It's a whole. It looks like an abandoned prison, but it is delicious.
Really?
Yeah, it's amazing. It's so good. It's so good.
Okay. I will definitely check that out then.
So then I would say let's plan to not meet on Monday, but
meet Thursday.
Let's meet Thursday, right? And my prayer, Jason, is that you just pass the test and we don't have to think about this. So for Charlene, you're not testing yet, so you come up with a plan for the next four sessions, right? 4 weeks, and I think just go 4 weeks, plan it out. Differential diagnosis, ethics, life cycles, something, and put it on paper and let me work it with you. I'm much better if I have a plan. I think you guys are too.
Yeah.
Okay.
Yeah.
Okay, cool.
Perfect. We got this.
Okay.